Have you ever imagined school life without classrooms and toilets? More than half of the children under the age of 17 live through multidimensional poverty in many areas, including nutrition, education, and sanitation.
In terms of quality of life, they are ranked 168th out of 188 countries in the Unhuman Development Index.
In response, KOICA, along with UNICEF, promoted a project to provide high-quality basic education to vulnerable children and improve the public health environment in the northern Sabon province of Togo, based on our government's Better Life for Girls initiative. Then let's take a closer look at what kind of business KOICA has promoted. First, we promoted various projects for school-aged children and out-of-school children. Education awareness activities were carried out for parents and local communities to help children receive basic education in a timely manner, and children outside of school be incorporated into the regular curriculum. In particular, non-regular education programs were provided to children outside of school to help them transfer to the regular curriculum. In addition, essential learning materials such as textbooks and school supplies were provided to students in the region,
and supplementary learning programs have also been carried out to assist students with low levels of academic achievement.
Therefore, we conducted teaching method education for teachers and established and operated a school management committee to provide high-quality education. In order to improve the sanitary environment of vulnerable children, safe drinking water facilities and sanitary toilets were built and improved in schools and communities, and a continuous management system was established through the committee. As a result of the evaluation, the business performance was very successful. Through the project, more than 38,000 students enrolled in 110 schools to receive formal education, and 570 children received non-regular education benefits. In addition, 2 schools and 6 classrooms were newly built to expand educational opportunities for children who had difficulty continuing their studies due to poor environments. 594 teachers participated in competency-building education, such as teaching methods, and 180 schools received coaching through local education offices, improving the quality of education. As the efficacy of teachers who participated in the education increased,
it led to many positive effects, namely the improvement of students' learning understanding and achievement levels.
In addition, 15 schools have installed drinking water sanitation facilities, allowing more than 7,000 students to use drinking water safely and 9,300 students to use improved toilets. Wells and toilets were also installed in local health centers, providing safe water to 49,000 residents and sanitary toilets to 56,000 residents. The improvement of health center facilities has also improved the health and hygiene environment across the region, such as improving the health of mothers and newborns who give birth at health centers. How did KOICA and UNICEF manage to make this change? The evaluation team cited the high professionalism of the performing organization, the utilization of local NGOs and existing systems, and the active participation of beneficiaries as the main success factors of the project. UNICEF Togo is an international organization with expertise in supporting children in vulnerable areas, and it has been able to carry out projects efficiently based on its understanding of the regional characteristics of Togo with high socioeconomic and political instability and expertise in the field. It also said that by establishing a cooperative system with local NGOs that have been active in Togo for a long time, and utilizing the teacher training system and textbook development capabilities of the Sabon State Regional Office of Education, we were able to further strengthen our community network and strengthen our public system capabilities. Finally, Savannah, where the project was carried out, was a region with high socio-political instability and high economic liquidity, which lacked government support compared to other parts of Togo. The local community's strong demand and willingness to improve poor social infrastructure allowed all beneficiaries,
including local government officials, teachers, parents, and residents, to actively participate in the activities and lead to the successful implementation of the projects.
The evaluation team suggested the following improvement directions for better changes in the future.
First, the team mentioned the need to develop organic teacher training and training programs. It was suggested to plan a teacher capacity building program that encompasses the entire process of teaching and education, starting from class preparation to execution, monitoring, evaluation, and feedback. These processes are organically linked with each other so that the overall teaching method education program can lead to the effective improvement of students' academic achievement while also allowing teachers who have participated in these programs to spread their experience and know-how to other teachers. They then suggested establishing an integrated network
for continuous maintenance of new classrooms and drinking water sanitation facilities. It is desirable to entrust the management of facilities to the residents' committee,
but the team suggested that there is a need for an improved system
in which local communities and local governments
can share the responsibilities of maintenance, as it can be a huge burden on residents.
So far, we've learned about the Education Approach Reinforcement Project for Togo children through the evaluation results. What more effort do you think is needed to improve this business?
Please leave your comments in the comments section
so that KOICA projects can create a better education and health environment for vulnerable children. Don't forget to subscribe, like, and set notifications for more evaluation content.
The evaluation process was conducted by an external evaluation agency and was deliberated through a review of the evaluation quality by the KOICA Independent Evaluation Panel.